Welcome to all our viewers live on TTT and live on the Division of Health, Wellness and Family Development's Facebook page. My name is Rian George. I am the Senior Corporate Communications Officer attached to the Division of Health, Wellness and Family Development. It is indeed a pleasure to have everyone live with us as the division gives an update on the different undertakings and more specifically towards our response to COVID-19. So on the panel, we do have with us in the middle, as we have here, Councillor Tracy Davidson Celestin, the Secretary of Health, Wellness and Family Development. To her right, we have Dr. Tiffany Hoyt, the Acting County Medical Officer of Health. To the far left, we have Dr. Roxanne Mitchell, the General Manager of Primary Care Services, Acting. And virtually, we have Dr. Victor Wheeler, the Acting Medical Chief of Staff. So we have quite a full panel to give several updates. At this time, I will invite Dr. Tiffany Hoyt as she provides some updates.
Hi, good afternoon, everyone. So the clinical update for Tobago is as follows. The number of samples that have been submitted thus far is 997 samples. The number of samples that have tested positive for COVID-19 in Tobago are 53. The number of active COVID-19 cases currently stands at 12. The number of patients at the COVID-19 treatment facilities in Tobago equals 9. The number of persons at the COVID-19 intensive care unit, which is at the Scarborough General Hospital, is equal to 1. The number of persons who are en route to the COVID-19 treatment facility is 2. And currently we have no patients at our step-down facility. Thus far, we've recorded only 1 death, and the number of persons who have been discharged stands at 41.
All right. Thank you very much, Dr. Hoyt, for that clinical update. We move on to virtually Dr. Victor Wheeler, who would provide us an update on the secondary care services. Dr. Wheeler.
Yes, good afternoon.
Good afternoon.
Right, I'd just like to give a brief summary on what has been happening at the hospital. As I reported the last time, we do have restrictions to the performance of major elective surgery, but we do have minor elective surgery and emergency surgery and cancer-related surgery continuing. We have the specialist clinics being performed by doctors from the hospital. They are still able to continue, slight modification with the times because of the restrictions in flight, but that service is continuing. We also have our outpatient clinics, all our outpatient clinics continuing as normal. I think I just want to say that at the moment we have been able to properly establish a parallel health facility in Tobago. Formerly, several months ago, we had used the current hospital at Signal Hill. Part of the hospital was for COVID treatment and part for non-COVID treatment. We have now been able to totally separate the COVID treatment center up on the fort. And at the hospital at Signal Hill, we are able to provide the care to all those non-COVID related persons. The only thing that still continues at the Signal Hill related to COVID is the COVID ICU, which I must stress is a separate building, which has no direct communication to the rest of the hospital. The services that are provided at the COVID treatment center at the fort includes services similar to what you would find on a medical ward. We can provide lab tests, x-rays, oxygen, intravenous fluids, and we have adequate monitoring of those patients. So it's essentially the capability of a medical ward up at the forts. Thank you.
All right, thank you very much, Dr. Wheeler. We move right along to Dr. Roxanne Mitchell, who will provide some updates from the primary care services. Dr. Mitchell.
Good afternoon, everyone. With regard to primary care services, we are actively involved in the swabbing of the Tobago population as it relates to the SARS-CoV-2 virus, the virus that causes COVID-19. Swabbing is done at 3 facilities across primary care: the Scarborough Health Center walk-in, the Canaan Health Center walk-in, and the Roxborough Health Center walk-in. As a result of reduced hours of operations at the 3 walk-ins, swabbing is done only from 8 a.m. to 4 p.m., Mondays to Fridays. The reduction in hours of service at the walk-in facilities was necessary to ensure that staff was available to conduct contact tracing activities in association with the Office of the CMOH. This contact tracing began in August, and we will update our service operation times accordingly. Persons who are followed up by primary care services contact tracers can expect the following. They can expect to be called on a daily basis, Monday to Friday, weekends included, and also public holidays. They can also expect to be asked questions about the symptoms in terms of whether they have a fever, whether or not they have symptoms of cough, runny nose, abdominal pains, diarrhea, that sort of thing. We are also going to be asking questions with regard to how persons are coping with their confinement. So please cooperate with the contact tracers when they call you. We are asking you to be as open as you can with your contact tracers and allow them to better assist you in the management of your case. Now, since the beginning of the COVID-19 pandemic, we have seen a shift in how primary care functions. Some changes would have included the introduction of the block appointment system. And we are asking for persons, please, to stick to their appointment times. We are still seeing persons gathering at the health centers hours before their clinic. We are also asking that if you cannot make your appointment, that you call ahead and ensure you have a next appointment. We will accommodate as much as we can to give you the next available appointment to ensure continuity of service. And this would include public immunizations. We're asking you to call your local health center and make an appointment, and please adhere to your appointment times. A little later on, I'll discuss with you some of the key roles that primary care is going to play with the ongoing pandemic. Thank you.
All right, thank you very much, Dr. Mitchell. And a final person on our panel, we have our secretary who would provide her updates.
Thank you very much, Rian, and pleasant afternoon to the listening public. I am here to add to what our medical team of professionals have said. And basically what you have heard from our 3 presenters here today is that, one, we have worked assiduously to create several pathways within the health system so as to treat with COVID-positive patients. 2, medical practitioners have been deployed at the primary care level, at the community level as well, to provide support to the public health team. And this, of course, is in an effort to have a faster response time to treating with persons in quarantine and who are to be monitored. In terms of the secondary care, which largely encapsulate the work at the hospital, we are, of course, working hand in hand to ensure that our systems are strengthened to treat even with those who do not have COVID. Additionally, we have discussed the establishment of a quarantine support desk, and that is in an effort to respond directly and to monitor any concerns that persons may have with regards to the receipt of information pertaining to test results. So we want to ensure that we have community liaisons who can answer any query, who can answer any questions as it pertains to their state of quarantine. And then, of course, we have been working assiduously with our partners in Trinidad to treat with the backlog of tests, and we are now also working from the perspective of the TRHA to increase further the capacity for testing on this island. And so this is where we are at this point. With regards to the social support that we have been providing for Tobagonians, last week we had a meeting with the Minister of Social Development, that is Donna Cox, and as it pertains to Tobago, I wish to share the following information, some of which would have been placed in the public domain. That, one, we agreed to the establishment of a Tobago desk, and that Tobago desk is, of course, to assist with Tobago-related queries. And additionally, TT Post, at that time when we had that meeting, TT Post had in their position approximately 200 checks for Tobagonians. I must say that 170 of those checks to date have been given out to persons. 30 checks are still in hand, and that is because they are now not able to find those individuals because of incorrect addresses. So I did indicate that the check should be brought to the Division of Health, Wellness and Family Development, and we will assist in finding those persons wherever they are so that they can receive those checks. Additionally, information coming from the Ministry of Social Development and Family Services as it pertains to Tobago support, the number of applications processed in terms of food support stands at 1,839. The number approved to date stands at 1,634, and the number of persons paid with regard or dealt with regards to food support is 1,540, and on hand there is about approximately 94 to be paid, and I know that they're working to ensure that they can treat with that in the shortest possible time frame. And 205 persons have been so far rejected. With regards to income support from the Ministry of Social Development, and I did indicate to you that persons who are now employed as a result of COVID but who have not been paying national insurance, NIS, or making their NIS contribution, they too can receive income support assistance. And to date, the ministry has received 1,833 applications from Tobago. Approved, the number stand at 1,568. 1,481 of those persons have since been paid, and there is 87 on hand to be distributed. And about 265 of them were rejected. So in terms of the total assistance in monetary amount given in addition to what we have been doing here at the level of the Tobago House of Assembly stands at approximately $7.2 million. And this is additional support coming from the Ministry of Social and Family Services, of course, complementing our work here in the Tobago House of Assembly, and in particular the Division of Health, Wellness and Family Development. In terms of our rental assistance grant program, we have received 965 applications to date. We have processed most of those applications out of the 965 received, and we have a balance of 140 to be processed, and our members of staff in the CSSU unit are working hard to ensure that we can treat with the 140 within the shortest possible time, frame. So there we have it in terms of food support from the Ministry of Social Development, income support from the Ministry of Social Development, and of course rental assistance grants from the Division of Health, Wellness and Family Development. And we have 140 on hand that are to be processed at this point in time. I also wish to indicate that we have been providing psychological support to families as well throughout the respective communities. Of course, we must emphasize the work that the officers have been doing, because we know that quite a lot of persons out there experiencing some level of frustration and would need mental health support as well as counseling support. And so the Family Development Department continues to provide that kind of service. They continue to provide that kind of care to our residents out there. And may I remind those of you, we provide therapeutic counseling We also treat with emergency relief support, mediation services. We have been providing support for substance abusers and abusers. We have also been providing empowerment opportunities for adolescent mothers as well. And of course, if you continue to experience any overwhelming situations, we ask that you call us, and our communication person will in short order indicate to you what those contact numbers are so that you can reach out to us if you're experiencing any overwhelming emotions or experiencing any level of frustration at this point in time. And so that brings me to the end of my presentation, the work that we have been doing in the Department of Health in terms of treating with those who currently are in our care with regards to COVID, treating with those who do not have COVID, and of course collaborating with our respective ministries in Trinidad, Ministry of Social Development, Ministry of Finance in terms of salary relief, and of course ensuring that the other aspect, which is the psychosocial aspects, are dealt with at the level of the Division of Health, Wellness and Family Development, providing counseling support, and also ensuring that we provide rental assistance where possible.
All right. Thank you very much, Councillor Tracy Davidson Celestine, for your presentation. And just continuing from her, the numbers to contact, we have 4 persons on team, and this is for the psychological support, our telecounseling service. We have Derek at 788-3861. We have Charlene at 730-7340. We have Carol at 730-7390, and Zena at 752-6252. So remember, this is not just COVID related, but generally if persons have overwhelming emotions, depression, anxiety, anything that you need to talk to a professional about, you can contact any of these numbers, and I will share the information a bit later in the media briefing. At this time, we will open up the floor to our members of the media to ask their questions to the panelists. And I just remind the media that for this press briefing, we will allow about three questions. And we ask persons to raise your virtual hand so that we can have some form of order as we seek to navigate the question and answer segment. So I see at this time we have Elizabeth Williams from TV6 News. Good afternoon, Elizabeth.
Good afternoon, everyone.
Hi, Liz. Afternoon.
Good afternoon to the panel. What I wanted to know is if someone needs a COVID test done, where do they have to go, especially someone who wants to travel abroad and needs that certificate? I don't know if Dr. Mitchell could repeat again where these people can go. I know Madam Tracy Davidson Celestine would have spoken about the meeting with Minister Donna Cox. What I wanted to know is how soon will the Tobago desk in Trinidad be set up? And how soon can persons be able to call the number to have an update on their grants? Because I'm still aware of, yes, we know that millions of dollars in grants have been paid out, but there are still some people who have not received their grants. So I was just wondering, a particular number that persons can call to get information about the Tobago desk. And I know there was, Madam Tracy Davidson Celestine said the total amount in terms of assistance. I don't know if you could repeat the millions that you spoke of before.
All right. Thank you very much, Liz. So Dr. Mitchell, for the first question, if someone needs to get a COVID test done, where can they go?
All right. So that COVID testing in terms of community surveillance is done at the walk-ins. We have 3 walk-ins. We have the Scarborough Health Center walk-in, Canaan Health Center walk-in, and the Roxborough Health Center walk-in. Travel is still restricted as far as I know. I will defer to Dr. Hoyt with regard to the travel-related testing, but primary care at present would be testing persons who have symptoms and who require ongoing treatment. Dr. Hoyt.
Hi, afternoon. So it is the current policy of the government that persons who require a COVID-19 test for the purpose of travel have to get that testing done at one of the certified private labs. It's not done through the public services offered at the government. Those are reserved for the response. You can look at the Ministry of Health's website to see a listing of the labs where these can be accessed.
All right, thank you very much, Dr. Hoyt. To the Secretary, how soon will the Tobago desk be set up and how soon can people call to get updates?
Well, one of the things we do, when the numbers become available, we will publish those via press conference. So the communications officer will ensure that that is circulated, widely circulated to the public.
All right, and just a repeat of the amount spent on the grants to date.
In terms of the grants from the Ministry of Social Development, the combined total for food support and income support stands at approximately $7.2 million. And from the Division of Health, Wellness and Family Development, with regards to monies paid out for rental assistance to date, it stands at approximately $4.5 million.
All right, thank you very much. I just remind the members of the media that we have our medical chief of staff virtually, Dr. Victor Wheeler, in the event you have any questions to pose to him on secondary care on the island. Next in line, we have Withfield Turner from I-95.5. Good afternoon, Withfield.
Good afternoon, Ryan. Good afternoon to everyone on the panel.
Good afternoon.
My first question, I believe, might be for Dr. Wheeler, actually. It pertains to the promise the ramping up of our testing capacity in Tobago. Are we any closer to knowing exactly when that will actually take place? And my second question, how many ICU nurses do we have in Tobago, and do we have sufficient, given that we are now seeing patients requiring ICU care? And for, well, I guess Dr. Wheeler and for Secretary Davidson Celestine, what aspects of Tobago's COVID response would you say is under the greatest strain at present? The areas that you think are under the most amount of pressure and so forth. Thank you.
Thank you very much, Whitfield. To Dr. Wheeler, ramping up of testing in Tobago, when will that take place? Are we any closer to that point?
Well, efforts are underway to have this done. However, I can't give any definite timelines at this point in time. With respect to the question on ICU nurses, the country itself has traditionally a shortage of ICU nurses, but there have been several training programs that have been underway. We also conducted some training programs in Tobago to increase the capacity. But at this point in time, I can't exactly say how many number of nurses we have. I can find that out and pass it on to Mr. Turner at a later point in time.
All right, thank you, Dr. Wheeler. And to the Secretary, what aspects of Tobago's response would you say is under the greatest strain?
Well, the thing is, it will be in terms of human resources, those who are involved in the public health services, those who are involved in medical care at the level of the primary care level, at the secondary care level as well, and those who are engaged at the Division of Health Wellness in terms of treating with the verification of applications, in terms of treating with assisting persons out there who may be experiencing COVID-related challenges. So in terms of our human resources, this has been ongoing for quite some time now, from since March to September, and the COVID really has not yet let up. And so I know that it's taking quite a toll on the members of staff in the health, the care services at this point in time, and then of course on our financial resources in the division at the level of the Tobago House of Assembly, and I suspect at the central government level as well.
All right, thank you. Another question is posed to the Secretary of Health, but I know that Dr. Hoy could assist with this as well. This question comes from Clayton Clark, 92.7 FM. He asks, what is the status of the backlog of outstanding tests? And as we know, our tests went to Trinidad, but what's the status of those, of the backlog?
So, with respect to clearing up the backlog of tests, I don't want to commit to a timeline, just to say that it's actively being addressed. A large number of outstanding results have been received. We still have some that are outstanding. I can say that for sure within 2 weeks, but I believe it would be in a shorter period of time, that all outstanding test results will be received.
All right, thank you very much. The floor is still open to anyone else who has questions. I see one coming in here. I see one coming in here from Newsday Tobago. We have heard, and this would be posed to Dr. Wheeler, we have heard of a COVID-19 critical case earlier this week. Can we be provided with an update on that patient? And is the number of patients critical still one? Dr. Wheeler.
Yes. The patient that was in the COVID ICU earlier this week is no longer there. That person has been moved out. So the facilities are the fort. And the person that is there now is a recent addition to the COVID ICU. May I just say that the facilities up at the fort are facilities that treat patients that are COVID positive and well, and COVID positive with some symptoms that require minimal treatment. If they do develop more serious symptoms, then they are transferred to the COVID ICU at the hospital. Signal Hill.
All right, but more specifically, they actually the status of the person. Just an update on that patient, the one that is currently at the ICU.
Oh, okay. The question was about a patient earlier in the week. That patient from earlier in the week who was in the COVID ICU is no longer in the COVID ICU. The patient who's in the COVID ICU now is a recent admission to the COVID ICU. So it's actually not the same patient.
Okay, thank you. We have questions from Whitfield again. Could go ahead, Whitfield.
Yes, thank you very much. Dr. Wheeler, what plans are in place in the event someone who is mentally challenged contracts COVID? I know yesterday the Minister would have spoken as to the plans that they have in place at St. Anne's. Do we have a similar arrangement in place here in Tobago? And as it pertains to the staffing, as the Secretary for Health just mentioned, how are we managing our staff in terms of burnout to ensure that they're not stretched beyond the point of no return, as it were? And when they become stressed, what systems are in place to help them to manage their stress? Because, of course, if they are not in a position to render the assistance that they should, then the whole healthcare process would be compromised.
Thank you very much, Whitfield. To Dr. Wheeler, what plans are in place for mental health patients who may contract COVID-19?
Okay, we don't have a dedicated facility where we can have a person who has mental health challenges with COVID. There is an isolation room on the mental health unit, which if we do have someone, we can temporarily house that person there. With respect to staff have been allowed to take leave. There has been no policy of suspending persons taking leave when they have to take leave. With respect to support for staff, as we've done ever since the beginning, the mental health department has cadre of personnel who provide counseling and support to members of staff. There's also the hotline that the Division of Health has that is also accessible to members of staff who need support.
All right, thank you very much, Dr. Wheeler. We have a question here from Clayton Clark again, 92.7. There was a report of the cath lab at the Scarborough Hospital not being utilized. The issue was raised at the Ministry of Health's press conference on Monday. Can we have a comment on that? The Secretary of Health.
Well, I would say that the cath lab is not in operation currently, and we are working very hard to ensure that we can utilize that particular unit. Of course, it's not very cheap. Based on the information that would have come to me, it's not an easy task, but we are very committed to treating with operationalizing the cath lab.
All right. Thank you very much to the Secretary. Any other questions? I would feel you on a roll this afternoon. Go right ahead.
Right. To Mrs. Davidson Celestine, you mentioned the whole arrangement that's being put in place via Tobago desk in Trinidad to render social assistance to persons. Why a Tobago desk as opposed to having the entire process managed from Tobago and, if necessary, simply sending the funding that is required from Trinidad to Tobago as per the quarterly releases block? Also, I've seen a billboard identifying a site for the rehab center for boys. I'd just like to find out if a site for the girls has been identified and where will adults go for rehabilitation.
All right. Thank you very much, Whitfield. The first question, why establish a Tobago desk versus sending the releases to Tobago for Tobago to manage them?
Well, let me say that at this current time, the approach would be a short-term approach. The process started sometime in March or April. And so what we have attempted to do is to try to treat with those issues that are currently in front of us. Of course, we are almost at the close of the financial period, and so there would be opportunities going forward in the new fiscal period, and so that will be a part of the medium-term discussion in terms of how we treat with assistance for Tobagonians, whether it has to do with rental support, food support, and all the other support that is available within Trinidad and Tobago.
All right, thank you very much. And the floor is still open to the members of the media before we wrap this media briefing. All right, I have one question here. Apparently some of our media personnel are having some technical challenges signing in virtually, so they are sending the messages via WhatsApp. As recent, and this question comes from Cassandra Thompson-Forbes from Guardian Media. As recent as Friday, the dialysis unit and other wards at the Scarborough General Hospital were strapped for syringes to administer medication. What was the cause of the breakdown, and when would this be resolved? Dr. Wheeler, this will be posed to you.
Okay, I actually wasn't aware of that, but I will try to get some information to see if and what has happened. However, the hospital does not have a shortage of syringes or needles.
All right. Thank you very much. I have a question from Clayton Clark, 92.7. Any talks on having any of the Cuban ICU nurses assigned to Tobago? Dr. Wheeler, the secretary, I'm not too sure.
There's been no discussion there yet. I have not received any information from the CEO nor the chief medical of staff for any additional IC nurses. If that information comes to hand, then we will start a discussion.
All right. One other question from Cassandra, Guardian Media. Are health workers given priority testing? Persons have reported having to wait over 14 days to get their results. What plans are in place to ensure that tests are done in a timely manner? And what is the average time period between testing and receiving results? So, Dr. Wheeler, the first question, are healthcare workers given priority testing?
Well, we do give priority to healthcare workers given priority. I'm not certain that if those persons who haven't gotten tests, were persons who at the time of testing did not indicate that they were a healthcare worker. I don't have specifics related to the particular health worker in question.
All right.
That I can look into.
All right. The second question, persons have reported having to wait over 14 days to get their results. What plans are in place to ensure that tests are done in a timely manner?
Well, I think Dr. Hoyt addressed that issue of the backlog.
All right. And the average time period for testing and receiving results, which I could repeat it just so that everyone understands.
So with respect to the average time period that persons wait, sometimes when you have anomalies where you have a large test come in, when there are a large cohort of persons to be testing, it may throw off what is the regular turnaround for results. So that would have happened in a couple of instances and generated a backlog. Going forward, things have been put in place so that we expect, and I don't want to commit, that I can definitely commit to the fact that persons would get results in less than 2 weeks going forward, for sure. I don't want to give an exact timeline, but just to say that we continue to address the issue, we continue to try to build capacity, and as capacity increases, the turnaround for results will also increase.
All right. Thank you very much. And our last question going to Whitfield Turner, I-95.5. Go ahead, Whitfield.
Yes, my final questions regarding the Tobago COVID hotline. How is that? Is it still functioning as well as it should? Are we getting regular calls as per usual? And I don't think I heard the answer to my rehab center question from earlier.
Yes. All right. So, Dr. Hoyt, how is the hotline functioning? Is it still operational?
So yes, the hotline is very much operational, and just to note, there was a lag period where there were not many calls coming to the hotline, and we saw an upsurge in the calls starting from around the 2nd of August. So I could share that to date, since the hotline started on the 22nd of March, we received a total of 2,578 calls. I would like to share that for persons who are waiting results and they have not yet received their results, they can contact the hotline for a follow-up of those results. But the hotline is very much functional.
All right, thank you. And to the question earlier from Whitfield, he understood there is a rehab center for boys. He saw a sign where construction should start for that. He's asking what about rehab for girls and what for adults as well? Any comment on that?
Can Whitfield Turner be a little bit more descriptive? Rehab center? I have no information on that one. Where did you see the sign?
This was at a government facility just outside of Fort King George.
I don't have that information. What I do know is that we have hostels under the care of the Division of Health, Wellness and Family Development, and those would be hostels for children. We work hand in hand with, Children's Authority to ensure we take care of our children in a particular way. But I am not very familiar with that sign announcing a rehab center for children.
Yeah, those were the words on the billboard itself.
Okay, well, I will look into that.
All right. I would allow the last two questions. One from Clayton Clark. He asks if there is any consideration in using the COVID testing apps to supplement actual physical testings. Dr. Hoyt.
So what I like to say is that we are guided by the testing policy of the Ministry of Health. So our testing is in line with the ministry's policy, and that has not come on board as yet.
All right, and final question from Elizabeth Williams, TV6 News. Go ahead, Liz.
Hi, good afternoon again.
Hi.
What I wanted to know is if a woman or a man is being abused in terms of domestic violence in Tobago. Sometimes I get these calls and I don't know how to direct them. Is there a particular facility in Tobago where domestic violence victims can be housed?
All right, thank you very much, Liz. Sec, any safe house for victims of domestic violence in Tobago?
All right, so we do have safe houses. However, we do not disclose the whereabouts of these safe houses. We look at where the person is coming from, and we will direct the person so that the perpetrator does not have access to them. So it's not something we can give out and say exactly where they're at.
All right, thank you.
We do have a domestic violence unit in the division, and it is staffed with intake officers, etc.
All right. So, Sec, any wrap-up before we end? Any other things to say?
Well, except that we continue to urge the public to follow the rules and regulations that are set, not only from the Division of Health, Wellness and Family Development, but our partner ministry in Trinidad, the Ministry of Health. We will do our part in ensuring that we put the systems in place, both at the primary care, the public health, and also the secondary care level. We are also working hand in hand with our counterparts to ensure that we are able to respond to the psychosocial needs of our people out there in the communities. But again, I want to emphasize the point that we are to wear our mask properly, and we are to follow those basic rules of washing our hands and covering our noses when we sneeze. I am still observing some persons in our capital, some person in our communities who are not wearing masks, and we really ask you to desist from such action, because the evidence is out there that wearing a mask can in fact reduce transmission. But from the level of the division as well as the Tobago House of Assembly, we are very committed to the process of providing as much care as is possible for COVID patients, and of course providing care for those who are COVID-free at this point in time. So we ask you to work with us, pay attention to the press briefings, pay attention to the news that are disseminated to the public, so that you can always keep abreast and informed of what is going on.
All right, thank you very much, Secretary. And just to share the information again before we go, for persons experiencing overwhelming emotions such as depression, sadness, and anxiety, at the division, we are here to help you. Don't be ashamed, don't be afraid. Just take up your phone and call one of the counselors. They are trained and ready and willing to assist you through whatever difficult experience that you are having. So we have persons in West Tobago. Derek, you can call him at 788-3861. You can call Charlene at 730-7340, or from the east, we have Carol at 730-7390, and we have Zena at 752-6252. And lastly, I just want to remind persons, if you have any of these following symptoms: fever, headache, sore throat, cough, runny nose, shortness of breath, muscle pains, loss of sense of smell, loss of sense of taste, or extreme tiredness, stay at home and call our Tobago COVID-19 hotline at 800-HEAL, H-E-A-L, that is 800-4325. Please don't venture out or go to the hospital or go to the primary care services if you know you have any of these symptoms. Call the hotline first, and then a doctor will be at the end of the line waiting to guide you through what you should do thereafter. So my name is Rian George. Once again, it has indeed been a pleasure. I encourage everyone, follow the public health ordinance, and let us all work together to protect each other from COVID-19. Thank you very much. Have a wonderful afternoon.